Hi, welcome to Real Medicine with Dr. Canuso. I'm your host, Dr. Dana Canuso, and we have a really exciting show for you today. I have with me Dr. Deborah Epstein. She is a gynecologist at Advocare Gynecology in Mount Holly, Maple Shade. Sorry, I always screw that up. Maple Shade. And we're actually going to talk about some interesting things today, and things that women don't necessarily talk about, but everybody's thinking. And personal experience, my mother has been through menopause for maybe 15 or so years, and she's always talking to me about these issues that come up. And I, thankfully, I'm not there yet, but I can't really relate to her. And as the older I get, I see, oh God, these are real issues that we have to talk about. And so today we're going to talk about a really kind of new revolutionary treatment for some of these common problems that postmenopausal women and even women that have other issues we'll talk about that are dealing with these problems. So welcome to the show, Dr. Epstein. Thanks for coming.
Thanks for having me.
You're welcome. So tell me a little bit about this crazy new procedure, laser that I've been hearing about, the Mona Lisa Touch. It's called.
Yes, it's wonderful. It is really a godsend for so many women. What it does is it treats the signs of vulvovaginal atrophy, which we now call genitourinary syndrome of menopause because they thought that was more appropriate and less intimidating.
Okay.
But what that is it's a dryness of the vaginal tissues and the vulvar tissues. It causes burning, itching, irritation, and difficulty with having intercourse because it's so much pain. It can feel like sandpaper or cut glass when you're trying to have intercourse. And then also there are things that go along with those other symptoms, such as difficulty with urination. So whether you're having frequency of urination, you can't control your urine, whether it's because you have the gotta go simplex, or whether you have the cough, sneeze, leak simplex. So all of those things are helped by the laser.
Wow. So women can have one or multiple, right? This is not like a whole syndrome that everything happens all at once.
That's correct. Okay. And impressively, 50% of women who go through menopause don't have anything.
Oh, that sounds good.
Right? So why is it that some of us have all these problems and some of us are just so lucky? We don't know.
Okay. And then some have one problem. Someone might come to you and say, okay, I have great sex, but it's killing me now. Or someone might say, I pee myself all the time, or I have to run to the bathroom. So
exactly.
Any sort of female issue down there that we go to our gynecologist and talk about, this is something that you can recommend to them, this Mona Lisa Touch.
Most of those things.
Okay.
I mean, we always have to rule out the possibility that there's an infection or some other reason that someone is having the issue with discomfort with intercourse or with urinary issues. But the majority of symptoms, this laser actually helps with significantly.
Okay, so when I think laser, I think Star Wars with like a gun and shooting laser. And I know from my practice that that's not what a laser is. But for viewers that don't really understand what you mean, can you explain what the actual laser is and how you use it?
Sure. So it's called a fractional CO2 laser or carbon dioxide laser. It's very safe. It's been used for years and years and years on people's faces, and some wonderful woman in Italy allowed someone else to put that laser in her vagina. And
it's Italian.
It's crazy, right? So what it does is the laser actually just irritates the skin of the vagina or wherever it is that you're using it, and then it excites these fibroblasts. They're these little cells that are important for healing, and those cells then try to heal everything. And so in process of healing, they bring in new blood vessels, they secrete collagen, which keeps your vagina strong, the skin strong. They secrete elastin, which keeps your vagina able to stretch. So now it can stretch and it doesn't tear because it's strong. And you have vasculature, so now you have moisture.
Wow. So this is helping with dryness, it's helping with pain, it's helping with tearing. And we were talking off camera about, this is a medical issue for a lot of people because if they do have vulvovaginal atrophy, they are prone to tearing or damage, and they could have sequela or maybe, God forbid, infection down the road, right? Sometimes.
Absolutely, and even urinary tract infection. So one of the things, and this is maybe a little bit technical, but one of the things the laser does is by increasing the epithelial layer, it allows glycogen to be produced and released in the vagina, and that glycogen is what, and most people know about this word lactobacilli, that's what they feed off of. And lactobacilli are the germs you're supposed to have in there that create the acidity to the vagina that protects not only the vagina, but it protects the urinary tract as well. So it decreases the frequency of urinary tract infections because now we have a normal environment what it was supposed to be.
Okay. So it's like this laser that looks like, the best way to describe it is like a tampon kind of, or like, is it like long? It's like a probe?
It's like a probe.
Okay,
it's
guys,
like a cylindrical probe.
Okay, and it's not massive or anything like that?
No,
okay.
no. It's actually pretty small. And we warm it so it's nice and warm.
Oh, that's nice.
Right?
Okay.
And it's actually more comfortable than a speculum.
Oh,
so if you think of it that way.
Okay. So men, you have no idea what she's talking about. But ladies are like, okay, I can breathe now. All right, so it's this laser. How long is the treatment? What, am I there for an hour? How long does it last?
So the treatment itself is pretty short, between 5 and 10 minutes. Of course, there's prep time, and we have questionnaires because we want to know how you're doing through each treatment. And it takes 3 treatments, about 5 to 6 weeks apart, till we get your fibroblasts up to snuff. And then it's a once a year maintenance.
Okay.
But what's really nice is it's done in the office, and it requires no anesthesia. There's no downtime, there's no prep time. There have been no complications reported with the procedure other than maybe a small urinary tract infection or a vaginitis, which is easy to treat, obviously. And it was FDA cleared in October 2014, so we know that it's a reasonable machine to use.
Wow, so this is really like cutting edge technology for dryness, pain, vaginal issues, and menopause. Okay.
Yeah. Prior to this, all we had was we had vaginal estrogens. That has always been the initial thing that we used to use.
Like a gel or a cream or something like that?
Yeah, or a pill that we put up inside.
Okay.
And since then, there has been a pill that you take that's come out called Aspina. That's another option. That's a systemic drug that is a cousin of tamoxifen and Avista.
Yep.
And then there's also now another new drug that's intravaginal that's DHEA based, but it's converted to estrogen while it's in the vagina.
Okay. So I don't love systemic drugs for many reasons. Systemic drugs have side effects that can affect the entire body. So I like the theory of a gel or a cream or a laser because theoretically we're like honing into the area we need to treat.
I am right there with you. If we're going to use something, I always tell people I'd rather have them use something that's local therapy than something that's systemic. So my favorite options are exactly the ones that you're talking about.
Fantastic. So what, this is an option, is this an option for someone that's already using those other treatments? Can they stop them and start using the laser? Or?
Absolutely.
Oh, good.
Absolutely. So you can go either way. If you use the laser, the laser is 85 to 90% effective. Pretty good statistics. And our practice, we're getting about a 90% success rate, which is great. We've treated close to 100 people at this point. And the nice thing is if it doesn't work for you, you can go back to estrogen or DHEA or any of those other things. And if you're using estrogen right now and you're concerned about using it, you're not comfortable using it, it's inconvenient, it's messy, you forget to use it, whatever, you can stop and go straight to the laser. You just have to have a week of being off everything.
Right. And it's nice to think compliance too, because with any medication you have to do it twice a week, or you have to remember to use it or buy it or pick it up from the prescription. It's all this compliance stuff.
Right.
A laser once every 5 to 6 weeks, 3 times, big deal.
Yeah.
I mean, that's in and out, done.
And once a year maintenance. So you don't have to remember all
and you
these
can
things.
do it with your annual exam kind of thing. You schedule it, or the next visitor.
Right. Something we have a little bit of an issue doing with the annual. When we first started doing it, I was like, oh, this is perfect. We'll do it with our annual exam.
Hello.
Yeah. Unfortunately, it doesn't work completely well that way because one of the things about CO2, the laser, is that it's absorbed by water. And we don't want it absorbed by water. We want it absorbed by your skin.
Right.
So when you do an annual exam, a lot of times you use lubricant to complete the process. And if you're going to do the laser first and then do the annual exam, that might be a little bit uncomfortable because the tissue has just been damaged. And normally you don't feel anything when you're walking out the door, but if you're going to put a speculum in there now, that might be a different story.
Okay. Well, interesting. And then, when we're going to take a little break,
Okay.
But when we come back, I wanted to talk more about that estrogen and hormone replacement therapy, because you did mention that that's an option. So I know a lot of people are scared of estrogen, especially with the questionable risks with breast cancer and all that. So we're going to take a little break, and we'll come back and talk more vagina. I can't hear it. Hi everyone, welcome back to Real Medicine with Dr. Canuso. And if you just tuned in, you missed out. You need to rewind the film. But if you're tuning in now, we're here with Dr. Epstein. She's a gynecologist, and we're talking about the Mona Lisa Touch laser. And we're going to kind of go into hormone replacement therapy, but I think there's a little bit more we need to talk about with this laser. We had a couple questions and comments from viewers before. One woman asked, is it a pinpoint treatment to the area of the vagina, or does the laser treat the entire vagina? How does the laser actually treat it?
Okay, really good question. So what we're doing is we're blanketing the entire vaginal canal. So we're firing little dots that penetrate like 1/1000th of the mucosal depth, and if you looked at it, it would look like a dot grid, so like a dot matrix,
right,
all the way through the vagina. Because that probe, it has a 90-degree firing angle, so it fires a square of grids, and then we turn it, and it fires a square of grids, and we turn it, and so we go all the way around, and then we pull it out a centimeter. And then we do it again, and then we pull it out a centimeter and do it again.
Right.
So it encompasses the entire vaginal wall.
Because there's no one spot that's causing the problem. It's the entirety of your tissue.
Exactly, because it's the dryness. And what does the dryness come from? It comes from lack of estrogen.
Okay.
So whether you have lack of estrogen because you've become menopausal for normal reasons, or maybe you had your ovaries removed, whether it was for medical reasons, or a cancer issue, or maybe you have cancer and you went through chemotherapy and you lost your period and became menopausal due to that. So those are all reasons that you would have vaginal dryness, painful intercourse, or any of the other symptoms.
You could theoretically be a 40-year-old breast cancer survivor and now have these postmenopausal issues.
Right,
Yeah.
right. As a matter of fact, I had a patient recently who was just like that. She had her second round of breast cancer. She was 42 years old, and she said to me, I feel like I'm 80. I have no breasts. I have no vagina left. This is horrible. And we treated her and we fixed her, and now she has her breasts done, and she's just happy as a clam.
She needs to go shopping.
Exactly.
Oh, that's exciting. Yeah, so this is not just, I think we have to get out of our minds that this is a vanity issue. This is only when you're postmenopausal. People deal with this at many stages in life for many reasons, and it's nothing to be embarrassed about. And it's something you need to discuss with your provider because it could lead to problems down the road. And why live with it if there's a treatment for it, right?
Absolutely, and a treatment that's so low risk. You're not putting a medication into your body. You're not taking a risk with a hormone. This is like a one and done kind of a procedure, and it's so important for relationships too. Right. People underestimate what sexual compatibility means to their relationship and how truly important it is.
Right. It's a total side note, but I even noticed that, about that time women go through menopause, it's the time when kids are leaving to go to college. You have this newfound sexual relationship with your partner, and now it's painful, and all these problems kind of pop up. Right. And you can either go the one way where you just stop having sex and stop having relationships, or you go the other way where let's fix this, let's work on this, and go. And for a lot of people, we think or people may assume it's a mental thing going on, empty nesting, but it may actually be a physical thing that needs to be treated. So, all right, so estrogen, I've heard a lot of scary things about hormone replacement therapy. And in my mind, I would love to keep my estrogen going. It helps with your skin, it helps with your hair, it helps with all these great things. Right. But yet I hear scary things about it. So can you educate me a little bit on should we or should we not do hormone?
Well, I am actually a proponent of hormone replacement therapy. So I have always been a proponent since I graduated from medical school. However, in 2002, there was a very large study that came out, which was the Women's Health Initiative. And that was an NIH study. And at that time, it said that at 5 years of use, there's an increased risk of heart attack and an increased risk of breast cancer, to the point that we need to stop the study and everybody should get off of their estrogen replacement therapy.
Oh my goodness.
So it was broadcast all over the place. The newspapers had it all over the place. There were two issues with that study. One was that in order to do the study, in order to try to keep people in the same group, whether you had estrogen group or non-estrogen group, they used women. The average age ended up being 63 years old. So at that point, you've been non-hormonal for 10 to 15 years. So anymore, is this a prophylactic? Right. Not really. So now we have women whose vessels are somewhat injured, and we're putting them on a medication that causes clots. So yeah, you're going to have an increased risk in heart attack. And in terms of breast cancer, we've always known that it probably does increase the risk of breast cancer a little bit, but the question is, if it protects against heart attack and doesn't increase the risk of heart attack, then it makes sense to use it even if it increases the risk of breast cancer slightly, because women in the United States do not die of breast cancer. The majority die of heart disease.
There was a fabulous lecturer, Dr. Sambucci. She's one of our cohorts. I love her. But she gave a lecture on women's heart attacks. And I think, don't quote me, but I think the numbers were how many women die of breast cancer? I think it's 1 in 27 get breast cancers.
I don't know the death statistics, but it's like 1 in 8 to 1 in 10 get breast cancer.
Oh, okay. But it was 1 in 3 women will die of a heart attack.
Right.
It's significant. Huge. And the other thing that she mentioned was that the reason women get heart attacks at
10 years afterwards
is because of a decrease in estrogen.
That's right.
So right when I heard that, I'm thinking, well, why aren't we replacing the estrogen? And she mentioned that the studies don't really prove one way or another that the estrogen does help with heart attacks. But either way, to me, it's kind of, there's so many different studies going on.
It makes sense teleologically, and when you look at the pathophysiology, it makes sense that estrogen should decrease the risk, right down to what it does to the endothelial cells, which are the cells that line the blood vessels that clog up.
Right.
So, yeah, you would think hormone replacement therapy would be perfect, but unfortunately, the way the study was done, it wasn't done the way we used to use estrogen. We would use estrogen in women who are newly menopausal,
right? And
so there was no time in between. So we were using it prophylactically for heart disease.
So have they done any studies since then, or are they kind of scared to do it? It seems like
they're in process. I think some of those studies are in process. And if you actually take out the subgroup of women that was 55 years or younger from the Women's Health Initiative, you actually see there is no increased risk in heart attack. So the right study needs to be done. The problem with that study is that women who are newly menopausal, many of them will be extremely, extremely temperature irregulated. So they're going to have a lot of hot flashes, a lot of night sweats, and if you're going to divide people into having medication and not having medication,
it's not very fair.
No, and you're going to get a lot of crossover. So everybody from the non-medicated arm is going to move into the medicated arm, and then you won't have anybody in the non-medicated arm to compare. And that's why the women ended up being 63 years old. So it's a conundrum.
Okay. So you recommend right at the onset of symptoms, maybe we discuss hormone replacement therapy. It's different for everybody, but you think?
I think it's a very reasonable move. Okay. And I am not allowed to say, the American College of OBGYN says I may not say that it decreases the risk of heart disease.
Okay.
And we have to use the smallest dose possible for as short a time as possible.
Okay.
That is the mantra.
How long do you use hormone replacement therapy for?
Well, we say that you should really stop by the 5-year mark, because that's when the Women's Health Initiative started to see that divide.
Okay.
Yeah.
So this is something that your new onset menopause, you do it for 5 years on a low dose, and then you kind of...
Right. But you have options.
Right.
As women, we all have options, and that's what it's all about. So if you decide in your heart that you research it, or you listen to your physician who's researched it, and they say, you know what, it makes sense that it should really decrease the risk, so why don't we keep going? Are you comfortable with that? Here are the risks, here are the benefits. You tell me what you want to do. And that's why I think hormone replacement therapy should be done at this point, because we really aren't absolutely sure. We aren't absolutely sure.
So, okay, so now back to the Mona Lisa touch. You can use hormone replacement therapy or not. You can use the laser in adjunct to that.
Correct.
Okay.
Because interestingly, so the lower third of the vagina comes from a different embryonic origin than the upper 2/3. And so there are less estrogen receptors in that lower third. So people who have tried estrogen therapy for the vagina may not have worked. So a lot of the initial studies with Mona Lisa were done with people that had tried the estrogen and it didn't work, and so they used the Mona Lisa and had this 85 to 90% success rate. Yeah, it operates by a slightly different mechanism than the estrogen does, and interestingly, estrogen does not really affect the deep tissues the way the laser does. So estrogen affects the epithelium, which is the very top of the tissue, and it thickens it, which is great, and it does bring back some vasculature. But it doesn't get to the depth where it really helps bladder issues significantly. So it doesn't do anything for incontinence issues. And mind you, the laser will do something for mild incontinence. If you're having a huge degree of incontinence, it might decrease a little, but you might not see that difference. But mild incontinence, whether it's urge or stress, the laser can be helpful for.
Wow, that's exciting. So I think it's something, and so how do you, I know someone's watching and they're like, I want to find out more about this. So they call your office, and we'll talk about how to get in touch with Dr. Epstein later, but they call your office and they say, I just want to talk to someone about it. Is there like a consultation that goes? Yes. So you set up a consultation, you have a discussion.
Right. And by the way, those consultations, they're no charge to the patient.
Oh, that's nice.
Yeah.
Okay, and then so they're not worried about going there and having it done right away if they don't want it to.
Correct.
Okay.
Correct.
So
Although many times if they've researched it and they say, I really know I want this, we still have to have the consultation. We have to make sure we have everything right and in place and it's appropriate. But a lot of times we can do it right then and there for you.
Wow, that's fantastic.
Yeah.
Okay, well, we're going to take another little break, and when we come back, we'll finish up our estrogen replacement therapy something. We'll talk a little bit more about Dr. Epstein. I have some questions for her on a personal level, and we'll come back, so don't go away. Hi, welcome back to Real Medicine with Dr. Canuso, and yes, we are talking about vaginas if you haven't already figured it out. And it's funny because those of you that know my background, I have a product line that treats feet and dry, cracked heels. And nobody likes to talk about their feet. So nobody talks about my product. They only kind of hide it or gift it. And the same comes with women and their issues, and especially their vagina. You'll talk over the dinner table or with your girlfriends out over drinks about how you're not having sex or what your husband's doing wrong, but you don't talk about your vagina. So maybe we need to start talking about these things.
Yes.
And we also discussed off camera that it can actually get worse if we don't treat these problems. So let's open up the conversation. Women come to you. How do they start talking to you about it, or what should we do to start the conversation?
So interesting, and I didn't start having this conversation with people until we had the laser available, because I felt like I didn't have enough options to give them. Mm-hmm. So I would gloss over it like many physicians would, and physicians don't even know about this laser, and so they're still glossing. Mm-hmm. But the bottom line is when it comes to social history, and you're asking, are you sexually active? And then I say, is it comfortable? Mm. Or is it painful? And that's how we start that process.
So if you have a girlfriend that's complaining about, I just don't want to have sex anymore, it's okay to say, well, does it hurt you? Because it hurts me. You're not alone out there. This is, right. You said 50% of women have this issue, right?
That's right.
Okay.
That's
or
right.
Some subset of the symptoms. So.
Exactly.
All right, so we need to talk more.
We do. We need to bring it up.
Yeah.
We need to tell our girlfriends that, hey, this exists.
Right.
And if there's a guy watching, you need to tell your guy friends, hey, this exists. Is your wife having a problem? Because if she is, there's something you guys can do about it.
Right, and so most women will go straight towards like a lubricant or something if they're dry. And you said that actually, does it stop working or how?
So when we first begin to have that vulvovaginal atrophy and dryness, a lot of times lubricants will be effective and will be enough to get us through. And sometimes women can continue to use them and they will be okay. But a lot of women, what happens is this dryness, this atrophy gets worse and worse and worse over time. It's not like a hot flash that you get in menopause, and 80% of women are finished with their hot flashes after 2 years. No. This atrophy continues to worsen, it progresses. So when we talk about the atrophy, we're talking about not just dryness, but the vagina actually shrinks. So it gets shorter, it gets more narrow, and as you progress through that whole symptom complex and through that whole progression of atrophy, it becomes more difficult to treat. So it's really important that when you see it starting, that you be aggressive about treating it.
Right, because you said basically once it gets shorter, there's no way to lengthen it or go backwards.
We've tried, and it works pretty well, but it takes a lot of stick-to-itiveness, a lot of commitment. Because what we do is first we make the tissue healthy using the laser, and then we've been using dilators to reopen the canal, to re-stretch the canal. But that's uncomfortable.
Right.
And if you could do it before you get there,
right.
Why not?
Right, and it all starts with a conversation and the ability to talk about it and be comfortable talking about it.
Right.
Very good. Well, this has been a crazy informative show, and you are going to come back because there's just so much to talk about, and I'm a big fan of women's health issues, and I hope you have learned something because this is something that needs to be talked about. So now, side note, my little fun questions. I need to know more about you. So, what is your favorite book? Anything. It doesn't have to do with medicine.
Oh no, I can answer this so fast.
Okay.
The Outlander and the series.
Okay.
My favorite.
That's hysterical. I've never read.
You haven't read it?
No.
Oh my gosh.
I'm a big nonfiction reader.
Okay. Well, this is based in the Scottish Highlands in the 1700s. It's actually historical fiction.
Oh.
So I don't know if that appeals to you.
No. Okay.
No,
Skip that.
Okay. Has the best hero and heroine ever.
Oh, really? Oh, that's funny. Did they make a TV show?
They
Yes.
did. They did. I had read all the books already, and they have a little side shoot, and I read that too. And then I saw that the television show was coming out. I was like, oh my God, this is great!
All right, what about, favorite restaurant? We're from South Jersey, which has some great restaurants, but it can be anywhere in the world. What's your favorite foodie thing?
I love Tallulah's Garden.
Oh.
My favorite. They have these cherries, what are they called? Luxordo cherries that they put in their Manhattans.
Yum.
I think they're soaked in whiskey before they even get in there.
Delish.
They're like these huge, they're not actually, they're type of maraschino, but they're huge and they're dark. They're so good.
Yeah. And I know you're a physician and you don't have a lot of free time, but what internet apps or resources do you use that make your life better or you like that you want to share?
Well, I have two. Well, one is Hippocrates, which is, you put it on your phone, it's great, so you can look up any drug in the world and it gives you a basic of it and what it's about and how to use it. So that's one. But my favorite is UpToDate.
Oh.
And UpToDate is an internet site that you pay for, but you can look up anything. I can look up heart disease, I could look up anything about podiatry,
right.
And it would give me a beautiful explanation with great citations, and it makes you feel like you know it and you've been practicing it. So do you have
to be a physician to purchase that?
Yeah, that's a really good question. I am not sure if you have to be a physician to purchase
UpToDate.
I wouldn't think so either.
It's something we should definitely find out because I think for our viewers that you're watching the show to become educated. So I remember being a resident and always looking through UpToDate and what's the latest studies or how do we do this. So,
right.
Well, that's a really great thing. All right, so I know people are dying to meet you, talk with you, get this laser done. I have someone very near and dear to my heart that I'm going to make come and visit you. But if you want to tell our viewers where to get in touch with you, that'd be great.
Great. So you can visit us at our office and feel free to join our practice. We would love it. Our office is on Lanola Road, right across from the Morristown Mall. And our phone number at our office is 856-234-4436. If you want to know more about the Mona Lisa laser, you can go to www.
Is it MonaLisa.com?
Well, there's that, and then there's centerforwomenswellness.com. So if you go to www.centerforwomenswellness.com, we have a really great website with lots of links, and you can really inform yourself well.
Very good. And as always, if you need to get in touch with me, you can go to drcanuso.com. You can Facebook me at Dr. Canuso. I would love to hear from you. And we're getting to that point where I'm getting show topics, ideas, questions. So please ask your questions. And I look forward to seeing you next week, 12:30 on RVN TV. Have a great week and happy Thanksgiving.